Hi, this is Dr. William Portuese in Seattle, Washington, board-certified facial plastic surgeon. Today we're talking about ethnic rhinoplasty and the concerns that ethnic patients have regarding a rhinoplasty. Some of the concerns there that they express to us is they do not want to have any external incisions on their nose if they can avoid it. These rhinoplasties that we're showing today have been done through closed rhinoplasty techniques where the incisions are placed on the inside of the nose. The first patient is a 30-year-old Hispanic gentleman who underwent a rhinoplasty in our practice, and we removed the nasal hump by shaving down both cartilage and bone off his nasal dorsum. The next photograph shows how we've taken down the dorsal hump, but we've also added a small amount of cartilage to the glabella area to soften the transition between his forehead and his bridge line. I also took off a little bit of his nasal tip cartilages to give him a narrowness and reduction in the tip area. Third photo shows the patient who underwent osteotomies to narrow and straighten the nasal bones from being crooked from a previous fracture. The next patient is a 44-year-old Middle Eastern woman who was concerned about a bulbous nasal tip that was quite droopy and dependent, especially when she smiled. For her, we actually reduced the bulbous tip with tip suturing techniques. We lifted up the tip and we narrowed the nasal bones by performing osteotomies. She also underwent an alarplasty by excising 3 millimeters of extra skin from the base of her nostrils to narrow the nostrils as well. The side profile shows where we have taken down the hump, released the depressor septa ligament so that when she smiles, her tip doesn't droop down. We've also raised her tip as well, and here's her 3/4 profile. Thank you.